was taken back, and I thought, because being in a hospital and working with so many psychiatrists in the past, I see them very good at, and this is not a derogatory remark, but many of them dispense a lot of medications, and they see very, very ill patients. And as we began to chat, you told me how diversified your practice is with all types of patients, all ages also. And I just wondered, why would a person or a family seek you out when they're so reluctant to go to therapy anyway and choose you over possibly a counselor or therapist that is usually one that someone would go see, if they're going to go at all?
Right. You bring up a lot of good points with that. You can think of mental health professionals in terms of a hierarchy of their training. I, as a psychiatrist, have the most training, the top of the hierarchy, if you will. Talked about that. We had 4 years of medical school, 4 years of residency. I am a physician. I was a physician before I was a psychiatrist.
And I think that's important for people to really understand that prior to your specialty, and your specialty is psychiatry, that you had to go through being a doc.
Yeah. So I'm uniquely qualified to treat the whole patient. There's a host of conditions, medical conditions, such as problems with the thyroid that can cause psychiatric problems, can even throw people into manic episodes, which might contribute to them going and having an affair. And so I have a medical perspective as well as a therapy perspective. There's many fine therapists out there, and they fall into 3 groups roughly. There's the doctoral level; those are the PhDs, the PsyDs or the PhD EDs, and they've gotten doctorate degrees. And
this is important, listeners, for you to really pay attention to, because it's going to help you at some point when you really do want to seek professional help.
So they are limited to only talk therapy. They, of course, didn't go to medical school, so they're not going to treat medical conditions or probably recognize them.
And nor do they dispense medication.
That's true. They're not going to order any lab tests or treat you with a mood stabilizer or an antidepressant or anti-anxiety medicine. They're limited to only talk. So the first level of the talk therapy only is the doctoral level. Then there's the master's level. They've gotten a 4-year college degree and then a couple of years, usually 2 to 3 years after that, of training. Those are the LCSWs, the MSWs, the MFTs, and the MAs. And then the lowest level, if you will, of the training requirements is the LADCs. Those are licensed addiction counselors. They've got usually a 4-year degree, or sometimes a little less than that. So it gets down to the training of the person.
Now, if I were having an affair and I wanted to maybe end an affair, and I was going through a tremendous amount of devastation, whether it be financial, emotional, possible divorce, what would I do? Just call you on the phone? Because most people, most lay people out there, regardless of who they are, their socioeconomic education, wouldn't think to actually contact a psychiatrist for help in that area.
Yeah, I would recommend that they see a psychiatrist first, because there can be a lot of co-occurring disorders with the infidelity. Usually, infidelity doesn't happen in a vacuum. They might be depressed as well, or anxious, or lonely, or like I said, they could have any number of other medical conditions.
Sure.
And a psychiatrist would pick up on that and could treat that. And sometimes anxiety is out of sight, and they need a medicine quickly to help them stabilize, and they couldn't get that from just a talk therapist only.
Now, when you said first contact, intake, etc., would be to come and see you, so what I hear next maybe would be you have a list of particular therapists that you use and refer various people to?
Yes, it's very common for me to get referrals from other therapists and to refer to other therapists. Usually it centers around money, because, as you can imagine, a psychiatrist isn't cheap, and the therapists, they tend to be a little cheaper than I am. Also, I don't take insurance or do any insurance billing, so payments expected up front. And other therapists often do take insurance, so that can be more convenient for the patient. But I don't do that because it made me pull my hair out, and it was maddening dealing with the insurers. So,
You might need help yourself.
yes.
Usually, though, when your patients that would become clients of a marriage and family counselor or a psychologist, at that particular point in time, don't they take insurance? Therapists usually are able to collect from insurance companies.
Yes, many of them do. And if I build insurance companies, I could collect as well. But like I said, I don't choose to do that. The other reason I might refer is if they prefer to see a female therapist.
Very good point.
Right. So there are many reasons why I would refer and why they would refer to me. And it's common to have what we call split therapy, where me and the therapist divide up the workload. I manage the medications, for instance, and they would do the intensive, very time-consuming talk therapy.
That sounds like a good care plan. If a family comes in to see you, and you've seen the mom and you've seen the dad, you're seeing a teenager, they come into you with a presenting problem, possibly maybe about the teenager, and the teenager says to you, "You know, doctor, my dad's having an affair. Do you think I should tell my mom?" What would be your answer to that question?
That's a very loaded question, very difficult. I actually do see a lot of children and adolescents in my practice. I see all ages. And issues like that do come up. That's not a hypothetical question. That has come up. Of course, I would evaluate that child or adolescent, first of all. And, of course, safety is always a primary concern. So seeing if there's any suicidal or homicidal ideation or access to guns or weapons would be paramount. And then I would go through the entire evaluation, asking them, for symptoms of depression or mania or anxiety, substance abuse, and so forth. But that all is, would be the first hour that I evaluate them. But we would no doubt talk about what are they going to do about this knowledge that their, whatever, mom's cheating on dad or dad's,
cheating on mom.
Right.
Sure.
It really depends on the situation. There are so many variables and permutations of what's going on. The maturity level of the child or adolescent, the stability of the parents,
how many visits would you say, doctor, that would involve for you to spend time? That's a large burden for regardless of the age, for a child to have to carry and know. And I know that behaviorally they act out in various ways. And how long before you can determine your suggestion or advice to that teenager?
More great points you make, and another hard question. I would say